Welcome, everyone. Welcome to Breastfeeding Through an Equity Lens. My name is Jaleesa Jones. I'm the Breastfeeding Counselor, Community Outreach, and Health Equity Lead for the Department of Public Health, Division of Maternal, Child, and Family Health. Here's an overview of what we'll be learning today. The learning objectives for today is to present information about equitably supporting families who are breast milk feeding. This e-module is relevant to staff who serve families with young children because the history of lactation in America is vast. So are the needs of every family, and the barriers and needs of each family may differ. Health equity defined by the American Public Health Association is everyone having the opportunity to attain their highest level of health and living. Why is this definition of health equity important? When you establish a goal for everyone to have the same outcome, you must then assess, acknowledge, and address the barriers and circumstances that prevent individuals from attaining that goal in order to succeed and have real equity or justice. What is breastfeeding? Breastfeeding has been historically defined as latching an infant onto a woman's breast. In fact, the Merriam-Webster definition of breastfeeding is to feed a baby from a mother's breast. This definition is not equitable and does not allow for compassion or variation, which leads to judgment and feeling of inadequacy. What is breastfeeding or breast milk feeding through an equitable lens? Breast milk feeding encompasses many variations. For instance, some families use donor milk from a lactating woman, use spoons, syringes, cups, use devices called SNS, supplemental nursing or nutrition systems, to provide breast milk to their infants, have a lactating woman nurse their infant in their place, have never given birth yet induce lactation to be able to breast milk feed their child. Finally, latching your baby with a nipple shield is still latching your baby and still breastfeeding. Providing pumped or express breast milk is still breast milk feeding. Why is redefining breast milk feeding so important? It removes judgment. It allows rooms for individuals' gender identity and family dynamics to be honored. It acknowledges the choices and sometimes circumstantial challenges that many families may face in deciding how to feed their baby. Acknowledging racism, history, trauma, and the impact on breastfeeding. Due to the residual impact of racism and lack of adequate paid parental leave, many Black families opt to not even try breastfeeding. For Black Americans especially, there was and is a lack of modeling or long-standing culture around breastfeeding, especially about tradition and what's passed on from generation to generation. Things that should be taken into consideration are the access to culturally sensitive and competent support, paid leave or work environments that support lactation beyond the postpartum period of 6 weeks, racial trauma and history, wet nursing, predatory formula advertising, and barriers. What you can do as a provider or support person for families who are breast milk feeding. Ask what their preferences are, pronouns, identity. Ask what their goals are. Ask if there is any trauma or circumstances that may influence their needs. This includes medical history. Ask what they know about breastfeeding or what questions they have. Ask if they would like resources for additional support. Example, clinical, community, or support groups. Be non-judgmental and compassionate. Keep in mind that breasts have been historically sexualized and trauma may be triggered by breastfeeding. Thank you for your time. For any questions, please contact me from the Department of Public Health at jaleesa.jones@phila.gov. Please follow the link to complete a brief survey to help us improve this e-module and to receive a completion certificate. For LMS, click the link here. For YouTube, click the link in the description box. Thank you and have a great day.